Dorothy is a 68-year-old woman, lives at home with her husband and dog. 6 months ago, Dorothy experienced an ischemic stroke on her left side, which caused weakness and dysfunction on her right side. Although she made significant gains for the first 3 months in rehab post stroke, when Dorothy was discharged, she went back to sitting on the couch all day, watching Young and the Restless marathons with her mini poodle. Although Dorothy is completely independent in all transfers, she has had significant trouble with her ADLs, especially things that involve her right arm since she is right hand dominant. This has prompted her to seek out OT services again. Dorothy explained to the OT that she has experienced problems when dressing, such as obtaining clothing from her closet and donning shirts. Putting on makeup has become extremely difficult, as she has found that her arms tire quickly, which cause her arms to shake. This has also affected Dorothy's participation in social activities, because her friends appear displeased with her appearance lately. Reaching for objects on higher shelves in the kitchen or at the grocery store has been nearly impossible and became a safety issue as well. During her session, the OT assessed Dorothy's active range of motion using an assessment to determine which motions are experiencing dysfunction and to establish a baseline. He first had her perform active range of motion, then did passive range of motion to rule out joint rigidity or contractures. Since Dorothy had greater passive range of motion on her right side and no pain, the OT documented that deficits in active range of motion occurred in the following motions: shoulder abduction, shoulder internal and external rotation, shoulder horizontal abduction, scapular retraction, and scapular depression. The OT noted that most of these movements recruit muscles of the rotator cuff, which include the subscapularis, infraspinatus, supraspinatus, and teres minor. The next step was to check her muscle by performing a muscle manual testing on muscles of her upper extremities. This assessment allowed him to see that she did exhibit muscle weakness on her right side, specifically those of her rotator cuff, rhomboids, and lower trapezius, scoring a 3-. OT suspected that Dorothy's disuse of her right side attributed to muscle weakness of the shoulder and back, which ultimately affected her posture and her functional use of shoulder flexion. Dorothy and the OT collaborated together to design an intervention plan that was realistic and attainable. To strengthen muscles of the rotator cuff, the OT showed Dorothy how to implement shoulder internal and external rotation into her daily activities. He showed Dorothy how to activate these muscles when throwing the ball in proper form with her puppy every day. To strengthen her rhomboids, the OT showed Dorothy how to implement scapular retraction into her daily activities, such as when opening her closet door, front door, or refrigerator. The OT placed his hand on her rhomboids to show how far back she should pull the door each time she opened it in order to work the muscle appropriate. To work on scapular depression, the OT showed Dorothy how to engage her lower trapezius, getting up from the chair by pushing off the armrest. Dorothy is instructed to do this every time she gets out of her chair during commercial breaks at home to strengthen these muscles. To work on shoulder abduction, the OT explains to Dorothy the importance of engaging her right arm instead of compensating by using her left while she brushes her hair. She could even do this while sitting, watching her favorite soap operas. This movement activates the supraspinatus muscle and will also help strengthen her posture when using proper body mechanics. The OT reminds Dorothy to regain strength on her dominant hand. She must remember to engage it instead of compensating for it. To work on shoulder horizontal abduction, Dorothy is taught to reach for objects by reaching out to the side instead of reaching for items from a straightforward motion. The OT explains that Dorothy can do this throughout the day to help strengthen muscles of the rotator cuff, such as the teres minor. At the end of their session, Dorothy's daughter came to pick her up and met with the OT. Her daughter revealed that Dorothy's weakness in her arm and back pain had affected her social life too. She noticed that Dorothy's friends were embarrassed to invite her out since she struggled with her appearance, especially her makeup. Also, she noticed her mom had recently stopped going to the grocery store, which was probably due to her inability to reach for objects from higher shelves. This was a shame, because Dorothy used to enjoy doing this for her husband and enjoys cooking. Her daughter explained that Dorothy had been slowly isolating herself, and it had become a concern to the family. Dorothy explained that although she had her husband to help her at home, she did not want to feel like a burden and expressed that her autonomy was very important to her identity. They discussed Dorothy's interests and which activities she can participate in to be more involved within the community so that she doesn't feel isolated. The OT provided Dorothy and her daughter with a list of community resources that matched the interests she had mentioned. The occupational therapist empathized with Dorothy and her daughter. He provided them with education about continued care, such as home exercises, proper posture, and adaptive techniques. The OT reviewed some of the interventions he had done in previous sessions with Dorothy so that Dorothy's daughter can help remind her of the techniques that she had learned. Some suggestions included only keeping light objects up higher for now to help engage her rotator cuff muscles. She should use her right arm to grab the light objects as a form of exercise and strengthening. Also, Dorothy should keep all heavier objects at a reachable distance on the counter for now, as a safety measure and to avoid injury since her muscles are too weak to lift from high or low spaces. The daughter thanked the OT for taking his time and helping their family out, and Dorothy and the OT dabbed on it.